When thinking about where the Valley's at today, where it's been in the past and where it's going in the future, there's some really exciting things that are happening in the Valley. More and more we're getting services here that take us from being more than just a bedroom community, which I think is a great thing to be. There's a great quality of life here. It's hard to improve over what we've had here in the past, but there's some things coming that I think are going to really add to that quality of life. One of those is the hospital, and where we're going with the hospital to meet the needs of this growing community, to really take it from being rural, more of a rural feeling hospital, which is a good thing. We want to keep the good pieces of that, but with the facility to really take it to where it's more of a suburban feeling facility, but with the same caring hometown people. We're building out a new emergency department. When you look at how a trauma care is delivered, to have trauma bays that we actually bring a team of 9 people in around the patient when there's a trauma that comes in, to be able to get all of those people around the patient, the equipment that goes with those people. It's really going to translate into faster, quicker, safer care and better outcomes for the people that live here. Right now we have a mobile MRI. It's here 3 days a week. You know, to be able to have that inside of the building in a permanent fixed MRI suite means 24/7 access to that imaging, which is key to fast diagnostics, quick intervention, better outcomes for the patient. So that's huge to have that here 7 days a week. We're building out an Instacare, probably the most needed service in this valley, where people will have 7-day-a-week access, 12 hours a day, 7 days a week, to walk-in primary care. That's really important to our population when you consider that 67% of our population commute to Utah Valley or Salt Lake Valley for their job. To be able to have that access, so they wake up in the morning, they have a sick child, they're not quite sure what to do. Do I not go to work? Do I stay with the child? Should they go to school? Should they not go to school? Can't get in to see a doctor. So to have that Instacare where they can bring them right in, have access to a physician, find out what's going on, have an early intervention for the child so that they can start feeling better, know whether they can go to school, know whether you can go to work, that's really going to be big for this community.